There he is, my man.
Ricardo, how are you?
What's going on, buddy? How you doing?
It's all good. Another dreary day in Baltimore. You guys enjoying the sun down there in Miami?
Absolutely. It's cold. It's like 72, 73.
All right.
Don't it's a little nippy.
Don't rub it in. It's 35 and raining.
Well, listen, man, thanks for joining us. I know how super busy you are. While everyone's logging on, I'm sure we're going to have a good crowd today. I'm just going to do a brief introduction. I'm not going to say anything that you're going to be embarrassed about, even though I have a lot of dirt on you. I'm not going to mention any of that. All right? I'm going to keep it strictly professional.
You're not going to bring up corking of the bats or anything, I hope.
No, nothing. I don't want to get anything controversial, so we'll just keep it professional for now.
I love it. I appreciate that.
So for those of you who don't know Dr. Nick Theodore, he is a great friend, colleague, and mentor. I met him probably 2010, back when I was looking at the Barrow for a job, and he's been a mentor ever since. He is a professor of neurosurgery at Johns Hopkins, director of the spine program and co-director of the Center for Surgical Innovation. World-renowned really for his work in spinal trauma, robotics, and personalized medicine. He graduated from Cornell University, attended medical school at Georgetown, and then did his residency and fellowship in spine surgery at the Barrow. 2003, he joined their faculty as Director of Neurotrauma. And then in 2009, he became chief of the spine section there. 2016, somehow he was lured away to go to Hopkins. And he is actively involved in preventative medicine within neurosurgery. He's been associated with the ThinkFirst Foundation for several years, having actively served as the foundation's medical director and president. 2017, he joined the NFL as part of the Head, Neck, and Spine Committee, and he is now chair of that committee. So we are very lucky to have Dr. Nick Theodore, close friend, colleague, and talking about a very important topic today about player safety in the NFL. So again, thanks for joining us, Nick.
My pleasure, Rick. Thanks. Pleasure to be here.
So we'll just start by talking about what a difficult problem this is. Obviously, player safety in the NFL is a big conundrum. You've got the biggest, strongest, fastest human beings on the planet playing football. Public likes the gladiator aspect of it. They like the big hits. How difficult is it for you guys to both maintain the sport, maintain the fan base, yet still have player safety?
So, that's a great way to start. I'm going to take one step back. Obviously, really the biggest thing in head trauma is prevention, right? And we talk about this all the time in youth sports and kids wearing helmets on their skateboards and their bicycles. Trying to prevent injury is really the most important. And here we are in the NFL in collision sports, where, to your point, we have high velocity, 100 G forces, helmet to helmet contacts, which are dizzying when you think about them. And the problem is daunting. It really is. It has gotten a lot of attention because of notable athletes who've had problems and the whole issue of chronic traumatic encephalopathy, et cetera. I think we start off by saying that today, I will say, and I think very few would disagree, that we are the safest that we have ever been in professional football, period. When we go back 10 years or 20 years and you watch video clips of these guys bashing heads, literally helmet-to-helmet contacts, happening 4, 5, 6 times in a game, the biggest problem I think that where we missed the mark was diagnosis. Because again, nothing starts in medicine without having a diagnosis, without being able to say that, yes, so-and-so had a concussion. That's the first thing. And I've talked to so many players, and there's been so much written about these players who played in that era, in the 60s, and the 70s, and the 80s, where you would have a concussion, they would be confused, but they would dust it off, get back on the field. So when we finally had the epiphany that this was a problem, it at least gave us an opportunity to be very introspective. And, at that time, two, very prominent neurosurgeons, Rich Ellenbogen and Hunt Beecher, were tapped to sort of start the program at the NFL. And that really started with something called the Concussion Protocol. And it really is it's a living document that we review several times a year. We have a panel of experts on the Head, Neck, and Spine Committee. And it really, to the detail, talks about how we diagnose a concussion, what happens, who can diagnose a concussion, and then spells out what happens for that patient. And player, patient, we can use those terms interchangeably throughout the course of recovery. So immediately you see we have two things that have changed, which I think have made an enormous impact. One of them is, what the hell is a concussion? How do we diagnose it? But then how do we watch this patient? And I would argue that just identifying it and pulling somebody out of play is a major health benefit, right? And we do know that with repetitive hits, certainly in short order, that the complications can occur. But giving the brain a chance to heal is, I think has been shown to have an enormously positive effect. That's not going to translate out for, probably 10 years until we know what happens. But that would argue we're in a much better place there. But I think the very first thing was making that diagnosis. And
Now, so, like to your point, right, we've always been concerned with player safety, but I feel like in the last 10 years, it's really become the preeminent issue in the NFL. In your opinion, what triggered it? Was there one sentinel event? Was it data? Was it the CTE that came out in the early to mid 2000s? What made NFL player safety such a primary goal?
I think the fear of CTE is one of many things. I think the reality is that the players started, having more of a voice, and people started getting concerned and asking questions. So interestingly, there's a yin and the yang in the NFL between NFL management and the Players Association. So there's Tom Mayer is an ER doc who's medical director of the Players Association, and now we have Alan Sills, who's the chief medical officer, who's a neurosurgeon from Vanderbilt, as the chief medical officer of the NFL. And then where I sit is in the middle. So my goal is to be objective. Of course, my goal is to make the game safer and the players safer. But now we have this an interactive group. So we've got players represented, we've got teams represented, and we have an impartial intermediary sitting on the fence, which is the head, neck, and spine committee, to be able to help evaluate the data and adjudicate that. But I think as far as the Sentinel event is concerned, I think it was a culmination of multiple things that came together at the same time that really brought this to the forefront. And I think, of course, when people get accused of either not taking care of the patient, neglecting the patient, or hiding things, and then there's a lot of scandal, I think, involved, et cetera. But ultimately, we're in a much better place now.
I don't think people really appreciate the amount of research and money that is spent by the NFL to do, further research in terms of injuries, and the officiating. Tell us a little bit from your perspective, how much is invested by the NFL to make players safer, the research, all of the different tactics they're using?
So let's just start from the beginning. Hundreds of millions of dollars are dispersed to third parties, to universities, for research, and there are competitive grants, and it's almost like a mini NIH to apply for the NFL for traumatic brain injury research. My very good friend Jeff Manley is a recipient of those funds. Jeff is probably the preeminent neurotrauma brain injury expert in the world, has funds. Different programs are starting very different ways of looking at brain injury. They're getting funds. The NFL spends, I will tell you, hundreds of millions of dollars. So what else is happening? We now, for every concussion, have a medical record. We're able to track these patients through the continuum of the concussion, the after effects. We have video analysis of every single concussion from multiple angles that are reviewed. We have the NFL employs full-time impartial statisticians to gather the data. And we're now rolling out something even more exciting, which is a very small mouth guard, force sensor that the players are wearing. Unfortunately, the data is not real time, but after the fact, they download it at the end of each game, and the few teams that are using them right now were able to accumulate that data. I would argue that outside of the American astronaut, there's no other population that we have more control over, and that we can actually have a better study. And it really is. It's a very unique opportunity, and I think the NFL is leveraging that fact, and that the downstream effects for college sports and high school sports and pee wee sports, it flows outward after that.
Yeah, I mean, it's great to hear that because I don't think people really appreciate how much the NFL is invested in making their sports safer. So it's great to hear that. What about the equipment? Everyone talks about better padding, better helmets, different cleats that don't get caught in the turf to tear ACLs. Tell us a little bit about how the equipment's evolving.
Sure. So that's a great, that was another great question, because the helmets are evaluated literally on a yearly basis. Every single helmet that's used. Jeff Crandall is a biomedical engineer who used to run the program at UVA, has a company now called BioCore, and every single helmet is tested every year through a very rigorous amount of testing. And in addition to that testing, we are able to then say which helmet's tested best, but then what happens in the real world? Who gets the most concussions wearing which helmet? So we started off with the red, yellow, and green. Green helmets, the best protection. Yellow, good, but not great. And then red, bottom, bad. But you'd think that we would be able to say, okay, everybody has to wear a green helmet. But again, there's a yin and the yang. Players association, players want to wear a smaller helmet. The running backs want a sleeker helmet. So it's evolving, but I will tell you now that the overwhelming majority of players are in green helmets, a few are in yellow, and we're getting better every year. The NFL also sponsors a challenge for the biomedical engineering community with grants and lots of money being dispersed for design the next generation of helmet. So there is a tremendous amount of money being put into this. And the interesting thing is that while you might think, and you never know until you look at it, the biomechanical testing and the reality match up perfectly. So in other words, those green helmets, those better protecting helmets, and when you show a player that, hey, this helmet, these players had less concussions, it's very powerful, and it's been used to change behavior. When you look at other equipment, same situation. There's actually a committee on turf toe, and these guys sit around all day. I would probably, end up bashing my head against the wall.
Sounds awful.
There's a whole committee looking at turf toe. So, there's committees for every part of every major injury that occurs in football. Thankfully, we don't have to focus on the head and the spine, because I think if I had to do turf toe, I might be looking for another job.
So let me ask you, you guys talk about how your concussion protocol is evaluated every single year. Tell us, what is the current return to play protocol? Someone is in a game, they have a concussion. How hard is it to clear them to go back either that game, or how many games are they at? What kind of testing has to be done before they're cleared to return?
Sure. So the first starts off with identification. So either the player can self-identify, a teammate can identify. We have two unaffiliated neurotrauma specialists on the field, one on each side, and a third neurotrauma specialist up watching the game with an athletic trainer. There are so many points of input, and anybody can point somebody out as having had a concussion. Once somebody's been identified as a potential concussion, they go into the blue tent at the side of the field, and they undergo a fairly rigorous but not extensive testing to sort of rule in or rule out concussion. And what's your suspicion? If there's a suspicion that there's a concussion, that person goes to the locker room for formal testing. And there's on an iPad and a complete neurological assessment with the SCAT testing and everything else that we go through for a concussion protocol. If in the tent they're cleared, they could actually return right after that initial evaluation. There are some things that we call no-go criteria. Somebody staggers when they get up. If somebody has some sort of fencing posturing, there are certain criteria that if those happen and those are visualized, that's a no-go. That patient goes straight to the locker room. So it's, again, all about diagnosis. Once in the locker room, they go through a formal battery of tests. Then they're followed up pretty much daily by the training staff. Once their symptoms start clearing, we can start increasing them slowly into aerobic activity, etc., all non-contact. They then get evaluated by a neuropsychologist who has access to the pre-concussion testing, does a comparison and says whether or not this person is actively affected, and in effect, they have to clear the person. Then the player has to see an independent neurological consultant, and that is usually a neurosurgeon or neurologist. That's the independent team consultant, so that's my role for the Ravens right now. So once neuropsychology has seen him, training staff has seen him, then the INC has to clear that person to return to play. Then if they're symptom free and everybody's cleared them, they could return as early as a week after the thing. To get through that protocol, the steps of the protocol, you usually will take about a week. And most patients are back the following week. If they have continued symptoms, then they're out for as long as they need to be, and there are always outliers. But I think the beauty of this entire program really is that it puts the brakes on getting somebody back too soon, gives them a chance to recover.
I mean, do you think we're doing enough? And from your perspective, if the answer is no, what would you like seen done for these players?
Well, you know, the nice thing is that let me say first that I do think we're doing, you know, enough's a loaded question. Could we do more? You know, but that's an evolving question, right? So let's look at that for a second. Let's look at rules changes as an example. You know, that's where we get into the real meat of the game, and it is very difficult to change the rules of football. And that is done at a very high level through management and team owners, and there's representation across the board, but that's a very, that is at the very highest levels of football. But it's data driven. So Alan Sills and the committee have done a great job of saying, hey, kickoff returns, let's look at that. Let's look at the behavior of lowering the head, which is now a penalty. That behavior, when you put that head down and you use your head as a battering ram and to strike another player, we know that's the highest incidence of concussion. Let's get rid of that type of tackling. So it is translated into the data that we've seen is translated into real and meaningful changes. What I would say is that, are we doing well? I think absolutely. Can we do better? I say this to my two sons all the time. Yes, you can always do better. We have to keep trying. We have to keep moving forward in that regard.
So I think you kind of alluded towards the rule changes, which I think is so important. Targeting you talked about, and the returns, which are less, because that's a huge place where you can get these high impact, collisions. What other rule changes are in the mix? What has been discussed? Again, what would you like to see be done over the next couple of years? What's in discussion?
Yeah, I think those are the big ones for right now, and I think we're going to see because that eliminates and would eliminate a tremendous burden. But interestingly enough, it's not just the rule change, because you've got players who are, it is an instinctual game, right? Some of these players are very good because of the way they do things. It really is going to trickle down to Pee-wee football, high school football, college, to sort of change those behaviors. And I think with those behavior changes and continued drilling in on those, but as far as what's on the agenda for other rules changes right now, there's nothing that's glaring. I think the biggest thing was the return, and also the lowering of the head were the two biggest. But as we continue to look at video, as we continue to analyze helmets and concussions, and it's pretty powerful to be able to see a concussion from 4 different directions, look exactly where the impact was, find out what type of helmet they wore, and then look at the clinical course. I mean, you really have, again, this unbelievable amount of data in longitude to study this. So, but right now, nothing else that's major on the books that I know of for as far as rules changes.
Got you. And, we talked about it. It was the very first question. The biggest challenge here is that players in the 1960s were literally weighing half as much and running half as fast. And what used to be a lineman in 1975 is like a safety now. Is there any way to combat the size, the speed, the strength of these players that is just over time, it just gets, more and more? Is that something you guys can combat at all?
The answer to that's no. But to your point, the people have gotten bigger and stronger. I thought you were going to tell me I needed to lose weight, so I was waiting for that.
Well, I was going there, but we're not going to talk about anything about you.
I'm glad we're not keeping it personal. But no, that's a great observation. These people these players have gotten enormous. And so I am 6'4". I weigh 260 pounds. When I'm in the locker room, it's the only time I feel like it's shrinking violently. I'm looking around, and these guys are, 6'9", 350. And that's just the nature, I think, of the selection and the athleticism and professionalism of the game. We don't want to change that, but we want to make it safer for even those guys who, again, when you talk about literally 100 Gs for a helmet-to-helmet, a hard hit, to mitigate the risks for all players. But that is a great observation. I don't know how we're gonna change that.
Has there ever been any discussion about weight limits? I had just heard that being discussed because obviously you can't change the height of players. You can't change speed. But what if you were to limit the weight? So safeties or D-backs have to be less than 210. Linemen can't be over 300. Linebackers can't be over 250. Is that anything that has been discussed? I know it's hard to do.
I know Jenny Craig was pushing for that, but you know, I don't. In all honesty, it's not going to happen. And I think that while weight is part of it, you know, that's, you know, and that does add something into the force equation. I don't think that's the biggest. I don't think that's the biggest problem. You know, I think the biggest problem, you know, we have so much. We still have room to improve with equipment. These helmets are insane. We're talking now. There are players, and a lot of players are wearing custom-made 3D printed helmets. You know, just imagine this technology that goes in the head gets scanned, and these inner pads are perfectly, you know, molded for the player. So the sophistication of those. Now, to that point, there's never going to be a perfect protective gear, but you know, their incremental improvement in that is really paying off in spades. And then, you know, again, the behavior changes. But as far as changing weight and putting limits on that, I don't think that's going to happen.
Not feasible. Not really feasible. You know, people have commented on the NFL's how they kind of prioritize financial benefit versus player safety, and sometimes those two can kind of clash. So, for example, discussion about expanding the season, right? Going to, instead of 16 games, going 17 or 18. Obviously, higher revenue for the NFL, more chance for kind of injuring the player. Playing the 2020 season despite the pandemic, many people thought it was unsafe. The NFL, of course, has a huge revenue. They've been trying to make it as safe as possible. We've been seeing outbreaks left and right. Talk about how you have to balance that, because obviously the finances are key here, and the NFL is one of the largest money-making sports in the world.
So let me start off by saying that Jeff Miller, who's the vice president for health and safety of the NFL, Alan Sills, are really held to a very high standard. And within the organization, these are two individuals who I'll call out, and their responsibility is player safety. I mean, so are they corporate? Sure. Do they work for the NFL? Sure. But there's a magnifying glass, and their job is to make this game safer. You've got also the input of the Players Association, because a lot of these things, when you talk about expanding seasons and doing any sort of change that affects the player, the Players Association has a say also. They have their own medical director. So there is, what I would say, through the collective bargaining agreement, the ability to have a discussion of the impact of any of these changes. So we can say that the NFL has a financial driver. Okay, nobody's going to dispute that. It's a business, and their business, you know, is to provide entertainment, and there's money associated with that. There's also safety and lives involved. So I think there's enough infrastructure both on the NFL side, Players Association side, and the intermediaries between those two through the collective bargaining to make those decisions on, you know, what that means. What does it mean for the player? And how does that get rolled out? So none of those decisions can be made in a vacuum. And no matter how, you know, let's just say you thought the NFL was just trying to push X, Y, or Z through, it's not going to happen, because there is a yin and yang, and a mutual respect, I will say, between those two entities in really making sure. And the mantra that Head, Neck, and Spine, and from the Players Association and from the NFL is the same. Nobody wants to be doing anything that's going to hurt anybody. And while there may be repercussions, we have enough in place from a data analysis and outcomes research to be able to hopefully pick up an early warning, to your point, if we do something that might put somebody at risk. But I think that, you know, all those things are complicated, but I think there's enough input that we can make those decisions can be made.
Got you. So it sounds like there's just checks and balances, and obviously nothing is going to be one-sided, which is good to hear. So there's definitely a subset of people who believe the NFL is just simply too violent, should be banned, the injuries are too severe. What's your take on people who feel that strongly, who feel that not only should you be working to make it safer, but the entire NFL should be banned and the kids shouldn't play football?
So everybody's entitled to their opinion, and if you don't want to watch football, that's fine. It really is ingrained in and a part of American culture. And if you look back, 100 years, it was incredibly dangerous sport, and football almost got banned. When you look at college football, there were deaths, 15, 20 deaths in a year, and it was at a time when these things were just starting. That was almost the end of football, and it turns out that that's how the formation of the NCAA occurred, and the safety things got put out. There's inherent risk, I think, and you know this as a neurosurgeon, in everything we do, right? I get in a car, there's a risk. I walk across the street, there's a risk. Everything we do has a risk associated with it. In professional sports, they understand that there's a risk associated with playing a professional sport. Our job is to make it as safe as possible for the player. Nothing is going to be risk-free. And I think when you step back, I think there's been a lot of fear, obviously, that trickles down to the high school level and to the Pee Wee level. Julian Bales is head of medical director of Pop Warner Football. He's a neurosurgeon, has spent his career in trying to make it safe from that end as we work our way up. But the reality is that what people tend to neglect is the fact that team sports, and football being a perfect example, have an enormous positive effect on children and young adult athletes. There are a number of publications which have shown that, decreased suicide, decreased mental health issues, this collectivism, this team sport, this being together, and just from a purely health standpoint of being out and exercising has a tremendous impact. And I think that when we start outlawing everything, and everything is too dangerous, there's going to be negative, connotations with that. When we look at in neurosurgery, look at people who played football. Look at Mitch Berger. Here's a guy who's a scion of brain tumors, played football in high school and college, played football professionally. The fact of the matter is that, there are so many examples of the positive effects. I think it would be a very big shame to say that, it's dangerous, we can't do it. I think that the better to say we've gotten so much better, let's continue to improve upon what we do and not throw out something that really has become such an important part of our culture.
Yeah, I totally agree with you. I think as someone who played varsity high school football, I can tell you that it has such an impact on your life, the way you approach things, all the dedication, the sacrifice, the teamwork, that stuff you kind of carry for the rest of your life, and you learn it during football. So just like you said, I don't think people truly appreciate all of the benefits of playing football. They only see the negatives. So, last question here, just because we're running out of time. What does the future hold? In your position as chair of that committee, what does the next year, the next 5 years, the next 10 years look like for NFL player safety?
So I think we continue what we're doing. What I'm very excited about is, the opportunity to look at, so we've got these mouth sensors, making those real time, but also let's talk about things that are on the horizon. Eye sensing technology to help us diagnose concussion. Jam Gajar, Uzma Samdani both have devices out, for instance, that can help us diagnose potentially concussion. And we're looking at biomarkers in the saliva or blood that might be a point of service diagnostic help for us for concussion, because again, what we lack right now is anything truly objective. It's still a clinical examination of the patient, putting them through a battery of tests, but we don't have any sort of confirmatory tests. So what I'm really excited about, and hopefully we'll see in the next 5 years, is something that we can say on the sideline, you know what, your enolase level is high, you're out. And, just to give us a confirmation, I think everybody would feel better. We don't have that yet. Some of the eye finding technology is very exciting. And I think we're going to, in the next few years, that will be perfected to the point where we'll have an additional tool to aid us in the diagnosis. And then as far as recovery is concerned, a ton of research is being done on that as well. What's the best way to recover the patient? Years ago, we would put them on ice for a few days, almost like the aneurysm patient, don't do anything. But we're finding out that early activity, not contact, but early activity is beneficial. So again, the way we treat concussion is being looked at as well. And then also, are there any other adjunctive agents? Are there any vitamins or other supplements potentially that can help, not just in the recovery, but for brain health? All this stuff is being looked at, and I think it's very exciting what's happening in the field, and I think we're good now, but we're gonna get better.
Oh, you froze on me. You there? Oh.
I am.
Oh, yeah, there you are. You're back. Listen, Nick, I can't thank you enough for your time. Absolutely awesome talking to you. Usually we would catch up at one of the meetings, but since we don't have meetings anymore, I guess this is the best way to do it. And thank you for all your input. I think I speak for everyone who's been watching that thank you for all you do. Such an important topic because we all love football, and I think making it safe is of paramount importance. So thank you for all you do, and look forward to catching up again soon.
Absolutely, Rick. Thank you so much. Have a great day.
All right, buddy. Take care. Talk to you soon.
All right. Bye.